on Monday, July 13th, 2020. This is the Board of Education work session. We are currently meeting remotely via Zoom pursuant to the Governor's Executive Order 2020-04, Section 8, and Emergency Order 12, Section 3, as we all continue to practice physical distancing. Mr. Gorino isn't here yet, so Ms. Brown has offered to call the roll. Go ahead, Ms. Brown.
I will call the roll. Paula Johnson.
Present.
Sandra Ziem.
Present.
Gloria Timmons.
Here.
Sharon Giglio.
Here.
Jennifer Bishop.
Here.
Heather Raymond.
Here.
Jessica Brown. I am here. And we have a quorum. Would you like me to introduce the rest, or would you like to go ahead and do that, Heather?
Sure. We also have this evening Mr. Norris and Mr. Gao, our student representatives. We also have Dr. Mosley, superintendent. We have Stacy Hines. We have Lisa Gingras, our athletic director, and we have Bobby Bagley from Public Health. And I see Dottie Oden logging in now. Have I missed anybody? Oh, we have Miss Quintanilla and Miss Bernardo here as well. Anyone else?
Thank you, Heather. I'm here.
Okay. Good evening, Dottie.
Yeah.
All right.
Thank you. Yep.
So this evening's meeting is specifically to get an update from Dr. Mosley's reopening task force regarding the work they've done so far, what they need us to know, and what they need from us for moving forward. So having said that, I'm going to hand it over to Dr. Mosley.
Good evening, good afternoon, everyone, or good evening. I know this is a public meeting. I know it's been a hot topic of reopening, not just for us, but actually as a nation. So part of what today is going to be is just an update, but also I think it's important to give it against the backdrop of current trends and patterns that are affecting us locally. So I believe the best way to start with this is just kind of I'll do a verbal overview, and then I'll turn it over to Bobby Bagley, our public health director for the city. Part of what is being proposed and what we talked about at earlier meetings was different models. Model number one was complete reopening of all of our schools under normal circumstances. All 11,000 plus of our students would go to school in a normal environment. The second proposal, which was model two, was a hybrid of going in person and doing remote learning. And then model number three was just completely remote, in which we did this past spring. So just keeping that in mind, I will turn it over now to Bobby Bagley to give us some feedback on those models, but also kind of a starting point of what's happening here in Nashua, and some of her thoughts and recommendations in terms of starting point. Once that is, once Mrs. Bagley does that, then we'll jump in and launch into a presentation based on the epidemiology of information that she will share with us, along with current trends, what's going on in the city. I think this is the best expert of what's going on in our city, but also in our state as well. So without further ado, Ms. Bagley, if I can just give it to you. And thank you for being with us.
Sure, and thank you for having me, and thank you to all of the members of your board for having me this evening as well. I appreciate the opportunity of being a part of the school's reopening task force and having had an opportunity to read through the three different proposed models for the school. And what I thought I would do first is talk a little bit about the epidemiology. So in public health, we tend to look at things based on the data and based on what the rates of disease are showing us, in our population, in our state, and then locally here in Nashua. Am I able to share my screen? I think I can. Yeah, all right. So what I have here is I have a,
Oh, there it goes.
can you see it?
Now we can see it. Thank you so much.
So I have on here a shot from the Department of Health and Human Services, their data dashboard. And this data dashboard is, what we use to see what's happening in New Hampshire with regard to COVID. I'm not sure if many of you have the opportunity to watch the news. I always ask my staff, are you watching the news? Because I really want them to pay attention. We have to stay on top of things. And there's so much in the news and people, tend not to watch it. But I watch it all the time diligently in the morning, afternoon, any chance I can get to hear about what's happening, with COVID across the country. And so right now, there's over 45 states that have had an increase in COVID cases after Memorial Day weekend. We have some states that have really hit the hot spot for them with cases that have exceeded, which used to be the epicenter for the U.S. With regards to COVID, which was New York. And at the height of New York's COVID outbreak and peak, some of the states, which was in April, some of the states right now are having cases peaking higher than what New York had at its highest when they were considered the epicenter. Those
You have to
states
use
include places.
Tinfoil or whatever.
Those places include states like Florida, Texas, Louisiana. So some of these states right now are really peaking. They're really hot. Right now in the whole entire country, our Northeast region right now is still in the green. So there is a map that the CDC, that John Hopkins has put out that shows all of the 50 states, and it shows how they're going from peach to pink to red. And New Hampshire, Maine, Vermont, Massachusetts, and New York, we're still looking okay. And New Hampshire is still very, very green, even pale green. So when I show you this summary dashboard so that you can see, even though we're green, we're still seeing increases in cases. And in particular, we're starting to see, if you can see this little cursor moving around here, we're starting to see increases in the age group that's between 20 and 30 right now. And so you can see what these numbers are here. Initially with this infection, we were worried, and we still are, so don't get me wrong, we were worried about the folks that were between 60 and 80, and you can see why. The majority of our deaths were in those who were above 80, when the majority of these folks were in nursing homes. And you can see the next largest percentage rate was in those that were 70 and 79, and you can see it goes down as far as death. You can also see here where it's talking about those that have been hospitalized and the infection. And when we look at this, and for me, what's significant is seeing these numbers here of people 59 and under, where they've now surpassed the percentage that we were seeing down here in folks that are 60 and over. So our percentage rate of folks that are older, it's not zero, but it's much lower than what we see for this lower population group. But what we're also seeing is the numbers are starting to go up here, 15, 13, 12, 16. If we add these up, this is over 60% of our infection right now. Key to your discussion with opening up the school is that when we look at the demographics in our schools, not just our kids, but we also have to look at the teachers and the administrators as well, what the age range for this group, for what this group is. We're starting to see an increase in cases being presented in folks between the 20 and 30 year range. And that's because of all of the activities that are going on right now with, businesses opening, restaurants opening, people can now, go out and really enjoy themselves, which is really important for our mental health and our well-being. But with people doing that and going out, they're not all taking the precautions that we need them to take. So we're starting to see more increased community spread. What we're also seeing is more contact, okay? And so what we used to have is a 0.4% contact rate with an individual who was positive. That number has now jumped up to a 1.4% contact rate. So there's more people who are exposed by one person being positive. So you say, okay, so what's the relevance of that with us talking about opening schools? We know that when people are gather together in large numbers, it increases the propensity for exposure and spread of COVID-19. What we're now learning about this virus is that it's not the strain that we have now in the US, which is very different from the strain that started this pandemic from Wuhan, China. It's also a very different strain than what we saw in Italy that spread really, really quickly. The strain that we have right now in the US is one that doesn't cause as much sickness and death, although from these numbers you can still see that we have people dying. We have now 391 deaths reported as of today, with 701 cases of COVID just in Nashua, and 40 deaths being reported in Nashua. So we know that there's still that kind of activity going on. With this strain right now, what they're seeing is that it's more communicable. It's more easily spread, and that's why our contact numbers are going up faster with our disease investigations. So as of today in Nashua, from our report out this morning, I mentioned we have 701 cases in Nashua. 89% have recovered, which is good. We have 40 deaths, and so that number has been pretty stable, with us staying within a 6% case fatality rate for us in Nashua. We have 72 active cases right now with 119 contacts. And what we've been seeing is that those contacts have been related to cluster outbreaks of people getting together in their private settings, at their pools, at parties, and going out into the community and then spreading it that way. Okay, so we look at all these numbers very, very closely. One of the things the reason that I brought this chart up so that folks could see is that these are the number of cases that have been reported in our state, which we don't hear about because the case fatality rate has been 0. So if you look at this, we've had 103 kids under 9. We've had 275 between 10 and 19, which is going to be our high school age range. But then if you look at these numbers here, this is our adult population of individuals that are at the age of folks that might be working in our school. So those numbers are up there. And again, because of some of the community spread. This is a data dashboard that we have for our Nashua data. And I'll send these links so that these can be shared so that you can go back and take a look at these. But again, you can see what's just happening here in Nashua with these age ranges here. Okay, so you can see how here, 10 to 14, we're up to 1%, 15 to 19, we're up to 4.79%, where those numbers weren't as high before. And those may seem like they're small, but they're not small numbers when we think about the number of contacts that folks can also contribute to exposure and spread of this disease in itself. When we look at these rates, and we're watching this very closely, we're starting to get more families coming to our clinic testing sites. Last week on Thursday, we had about 101 folks come through. People are starting to bring their kids through. We had 2 kids under the age of 10 come back positive from last Thursday's testing. What we're expecting is for those numbers to continue to increase again as folks continue to engage in activities. What is the relevancy of that for school and opening schools? The CDC has put out some guidelines for states, governors to consider with regards to school opening. Those guidelines do require for schools to take into consideration how they can best protect the health of the kids as well as the teachers and everyone else that's in the school. One of the things that we've also learned about this virus is that kids don't always show signs and symptoms, so they can be asymptomatic spreaders. And there's a term that we call super spreaders because they can, again, carry the virus, not necessarily have sickness to the point where they look that it's really, really bad for them or they have to be hospitalized, but they can spread the virus from other people, adults, in their lives, grandparents, and neighbors and friends. And so with the CDC guidelines, they're really looking at schools in each of our states thinking about what measures they can put in place with regards to safeguarding the health and well-being of as many people as they can. Some of those guidelines, and I'll send the website, Dr. Mosley, I'll send all this information, all these links to you so that you can share with the board. One of the things that the guidelines, talks about is making sure that you don't create these environments where you can have super spreaders spreading lots of COVID disease in these settings where there's large numbers of people gathered. And so those guidelines, and you guys have probably seen some of these, talk about, making sure the classes aren't full of kids and looking at, not having as many sports that where there's a lot of physical contact going on, looking at making sure that the classrooms where the desks are spread apart, at least 6 feet apart, and also looking at how you can incorporate hybrid, classroom time, in the schools. In looking at the models that have been presented by Dr. Mosley, the model that, as far as a public health perspective, that would be the most protective for our kids, for our teachers, and for the administrators that will be working in the schools with the kids, is a model that allows for the hybrid model where some kids are in school a certain number of days and kids are learning online. One of the things that has also come out with regards to school is that the importance of schools being open and kids having the opportunity to be together, to learn together, but making those opportunities as safe as we can. We still see individuals, kids, young adults, and adults that have underlying health conditions at risk for having poor health outcomes or hospitalizations if they come infected with COVID. And so with that, the model that has been presented, the models that have been presented, the one that seems that it would be the safest for Nashua kids would be your hybrid model, just based on what has been proposed and what we've read, and then also based on what we're seeing. The other piece of this is, as much as we want to see schools open, we're still in the early part of the summer. We're just starting to see numbers start to creep up. There is an expectation that there is going to be a spike, and they were thinking that it was going to take place September, late August, September, but across the country, it started already. It started right after the Father's Day weekend. There was a lot of activities that were going around. So all the holidays that are in between are the ones that kind of spark celebrations, parties, socializing, fun, and opportunities for people to gather together and lots of exposure. One of the main recommendations that the CDC is pushing right now, the World Health Organization, and we're pushing, is the use of masks. And so in the proposal, there is that component of mask wearing in the schools, which is going to be really important. So even if you have a hybrid schedule set up for the students, when the students and teachers are in the school and they are not able to maintain 6 feet of distance between each other in any of their interactions, masks should be worn at all times when that, in those settings. Hand washing, wiping down surfaces, all of those things are going to be really important. And I did see that in the plan, which again is going to be ideal for Nashua School District in the opening. So that's the information that I wanted to share as far as we're taking a data-driven approach. More information will come down. I know the governor will be releasing his guidelines sometime. I'm not sure if it's this week, but I do know that they're supposed to come down. And hopefully those guidelines will also rely on, having a data-driven approach and following recommendations. I'm sorry, but the sun, it keeps moving. Having a data-driven approach so that we watch the numbers. We will keep monitoring, we'll keep providing surveillance, and we'll keep providing update information as we draw closer and closer, to August and to, the opening time when school plan to open. If the numbers, and if we get to the point where things peak out, these will be things that will have to be reconsidered with regards to schools opening, because we want to keep everybody as safe as we possibly can. So I'm not sure, Dr. Mosley or anyone else on the board, if you have any questions for me.
Ms. Bagley, this is Heather Raymond. We had a technical issue where the screen went out and then stopped sharing.
Oh,
So I'm wondering if it's possible to get us a copy of your 2 screens that you shared so we can attach to our minutes.
okay.
So those who wanted to see and who weren't able to see out in the public can review those.
I will do
Or
that.
are they available somewhere else now?
These are all online. I'll send the links.
Okay, great.
This is the data dashboard from Department of Health and Human Services for New Hampshire. And then this other screenshot here is from the data dashboard that we have on our website for the Division of Public Health and Community Services. So I will send the link of both of these to Dr. Mosey, as well as, but you guys may already have the CDC guidelines, I think, right?
Yeah.
Yes, but thank you. I really appreciate that. Mr. Gao had a question, and then Ms. Brown.
Great, thank you so much, and also thank you, Ms. Bagley, for putting together a wonderful presentation. I definitely that had a lot of new insight for me. So I'm just really curious because you mentioned that you tracked like the contacts. So for example, someone like person A, for example, has COVID. You also track like who that person has interacted with. So I'm very curious. What percent of contacts end up having COVID? Meaning, like for example, if person A has COVID, they touch person B through Z, 25 other people. How many of those people, statistically speaking, of course, will have COVID?
You know what, Joshua, that is a really good question. I haven't had our epidemiologists break out that data, and I don't believe that I have that data in the state's website, but the expectation is for every one person that is positive, we've been seeing that there's at least 2 to 3 people that can be, that they're exposed to can become positive, you know, as a result of that. And so I'll have to have her take a look at to see what we have from our data and from what we've tracked, because that's the best way to give you a percentage from what we've actually been experiencing. The other piece of that is that you're only going to get that number if people actually go in and get tested, right? And so some people that may have signs and symptoms because they may be mild may not get tested because we're also in allergy season. And so sometimes people just kind of like brush that off to, it's just an allergy. But in some of the investigations that we have done, people have presented with symptoms so mild, it's just a tickle in their throat, and that's it. And then sometimes when we test those individuals, if they show up for testing, that's when we find out those individuals are positive. So the answer that you're asking is a little bit difficult to get, but what we can do is look at from our investigations, out of the context we've investigated, how many have converted to being positive. There's a way for us to get that number from the data that the state has and that we have here in Nashua.
Thank you so much. And also just a super quick follow-up, if you wouldn't mind. Is this data like public somewhere? Is it somewhere where the public can look into and perhaps like make a few conclusions on their own?
Yes. So both of these data dashboards are available. The data dashboard for the state is at nh.gov, COVID/dashboard summary, but I will send these links to Dr. Mosley, who will push this information out for you.
Okay, great. Thank you.
Thank you, Mr. Gao. Ms. Brown, and then Ms. Johnson.
Thank you. Thank you, everyone. And thank you, Ms. Bagley. That was an excellent presentation. I appreciate it. So this week, I sent a hybrid model to the task force. We didn't actually have a chance to meet yet. I'm really looking forward to that tomorrow. That would be, it would shrink class sizes kind of automatically and directly because it was a parent-teacher choice model. And I was wondering, you mentioned that we're in the green zone now, so we're kind of doing pretty well here in New Hampshire, which you've done a great job, and I commend you and your team for making that happen. So the points that we saw from those original hybrid models, what were the main things that make you think that that was the best option? Was it class size? Was it frequent cleaning? Do you have like the points from those models that would be the key points that we need to focus on when we meet tomorrow for the task force?
Yeah, so the key things in the hybrid are the class sizes, the opportunity for there to be the cleaning in the facility in between, the students coming, and then not given some space and time where they're, doing some stuff online to give time for the building to be cleaned. And also making sure that there's, a reduced number of opportunities for contacts and the distancing, right? So you need to make sure that that social distancing or spacing, with shrinking the class size, it allows for you to have the desks further apart, like 6 feet apart. And then with allowing for the wiping down of the surfaces, which is really going to be key when you're getting all these folks back into the setting, that's going to be important. Having kids buy into, I should say students, not kids, buy into having some responsibility and accountability for helping keep their the surface or the areas where they're in clean is going to be important as well. And then of course, wearing the mask. It's really that keeping people apart that's really important.
I have one follow-up also, Heather, right now. At what point do you think, like I said, we're in the green zone now, when do you see, would you feel comfortable sending us back to traditional learning?
We're hoping, so the thing with what's coming up with the fall is not only, the COVID that hasn't gone away yet, but we're also going to be coming into flu season. And so getting back, and then so flu season creates another opportunity for COVID if people come into contact with the virus to be really, really sick, because your immune system is trying to deal with that influenza-like illness. It's hard to predict that, Ms. Brown. It really is. We actually thought that once we flattened the curve, of this disease, across the country, because lots of states saw their numbers go down, that we would, get to the place which people did. They started opening businesses, they started opening up activities. And with that, you saw things go up. I anticipate probably we'll see more infection before things start to go back down. And it's only, again, because of how we are as social beings. And even with all those measures that are going to be put in place, it'll be less infection, but you're still going to get some infection because you're going to have more people coming together. So it's hard to really predict when that may happen. With the flu of 1918, it took 3 years before things got back to normal. With the Spanish flu, it took 3 years.
That was very depressing. Thank you, Ms. Bagley.
Depressing. Well,
realistic, but
realistic. So this is the thing. Everything really depends on us, because the virus can only thrive in us. And so if we don't allow for those opportunities to occur with the sharing of our respiratory droplets, if we can prevent that, we can slow and stop this. And maybe it won't take 3 years, but it all depends on us and our social behaviors. And so there's a lot of re-education that has to be done. People are really excited about being able to get back together. You can imagine how that's going to be when kids go back to school and they've been separated all summer long when they get back together. So we've just got to do our due diligence to help them understand how important it is for them, even when they are together face to face, to maintain their social distancing. That's going to be the challenge for all of us.
Hey, thank you, Ms. Bagley. I have Ms. Johnson and then Mr. Norris.
Hi, thank you. Ms. Bagley, I got a letter from a Mr. Sayer today, and I wanted to send it out to the board, and I'll send a copy to you also. Oops, let me get my video on. Okay, here's a letter, 2 pages, front and back. And it talks about air quality in the schools also. Talks about filters. This man has worked with Congress, so he really knows his information. And he was telling me on the phone about droplets in and I can't go through this because I'm not an expert in filtration. But I guess filtration has a lot to do with this, wouldn't you say?
So, Ms. Johnson, I am not an expert with those pieces. We actually do have a deputy health officer who has done a lot of this work prior to coming on board here at the health department. If there is a specific question in that letter that you received with some information, I will have him follow up and provide an answer to questions around filtration. That's not something that I would be able to answer.
And who would I email this to? Because I'm going to get this out to the board members and Dr. Mosley so everybody can have a preview of this, because we all know that filtration and we don't, and things, germs stay in filtration, it gets put back out. So I think that's a big piece. I know people talk about HEPA filters, ionic filters. I know, listening to epidemiologists, I've done my homework on this whole thing on COVID-19, and they also talk about UV lights in the ceiling that come down and, and it kills germs, but the lights have to be positioned a certain way so you don't get harmed by the lights. Putting lights on during the night when nobody's around, so it clears it out, and then during the day it would be clean. I'm taking notes on everything you're saying. I'm listening to people about what's being said. What else did I have here? Parents want to see the schools open up. I think that when we talk about the hybrid method of opening up, I have some concerns with kids not getting back into the classrooms, especially like if we're going to have masks on kids and ask kids to be socially distanced. I think that's a lot to ask of kids. Kids are more social than we are, but kids, I think in this from March until June, we've had a lot of problems. Kids need to socialize. Kids aren't the ones really that are getting, they can bring it home, and I'm listening to this whole thing, the peak. And I listened to it on the news of everybody getting scared again. The death rate has flattened the curve, Am I correct? We flattened the curve, which we were supposed to do.
We have in New Hampshire, we've done that very well. New York has done well, Massachusetts. We never peaked like New York or Massachusetts. We never saw the high death rates that they saw, which is actually really good for us here in New Hampshire. And I hope that we don't get to see any of that at the level of which they did. We did have one case, and it was the first case of multi-inflammatory syndrome related to COVID in New Hampshire. It was one of our youth here in Nashua. I would hate to see any other family go through what this family went through. That child was in ICU for 15 days. Mom was afraid she was going to lose her child. It may have been one case, but for me, one case is enough. I hope we don't see that again in any of our children. I don't believe that the child had any other underlying health conditions, but we know that in our schools, we have kids that have underlying health conditions like asthma, other, chronic diseases that they're dealing with. And, for me, I tend to go on the side of caution, with regards to, as much as we can, protecting, our kids. And if the hybrid model is going to work the best with the social distancing, with the mask, we do testing every week, Ms. Johnson, and I've had a chance to be at the testing sites, and we've seen small kids down to 3 come in with their mask on, and they sit there and they wear those masks appropriately. They're not fiddling with them or playing with them. Their parents get them masks that are cute and creative with the little designs on them, but they're also teaching them why they're wearing them. And as I said, I think if we can re-educate and help our kids, the students, our kids, because that's what they are, understand the importance of why they're doing what they're doing. Kids aren't, they're smart. If they could catch on to the elbow and the fist bump, and if they can catch on to the coughing and sneezing in their elbows, understanding the significance of this, many of them will. The idea is that if we can have 60% of our population wearing masks 60% of the time effectively, we can continue to see this drop and go down. And so that's the thing that we would like to be able to see happen. It is true that the kids do need to be in school. They do need to be able to see each other and socialize. I think with the education of how they can do that, we may see how our kids respond to that, appropriately.
Well, the reason I'm asking some of this is because, I've read emails from parents, I've talked to teachers, I've talked to parents. And kids wearing, it's not only just kids wearing masks, and I don't want to see anybody get ill. Let's get that, on the table to begin with, because I don't want anybody coming back and saying, Mrs. Johnson wants kids to get ill and the families. No, I don't. We've got special ed kids, we've got kids with underlying conditions, and I know we have family members with underlying conditions. It's a lot easier to remote a small group of kids because of these illnesses and problems like special ed than it is to take the whole general population. With that said, and it's none of our business what kids and the student you were talking about, if that student had underlying conditions under FERPA and HIPAA and privacy, the FERPA, HIPAA, and the Privacy Act, we should be talking about any child that was sick or any underlying condition, because now the city knows about that, and that's privacy. But I've also had articles talking about the CO2 gases that we breathe in that goes back into our lungs and can make us sick. So when I've seen studies here where they put the meter by the mouth and you might be at 19.5 and you put the mask on and all of a sudden it's going down to 17 and at 15, and these are OSHA meters, and it starts beeping. Now, you were asking a student, a first grade, a second grade, a kindergarten, to keep masks on for a long period of time during the day. How are we going to have these kids with the masks on and their break time to have 10, 15, 20 minutes to breathe without these masks? Because these masks don't come without issues with that CO2 gas going back into. And so I've got, you want to see this, a study over here with this, and I want to make sure that we don't have any problems with kids fainting in school or anything happening. I'm sorry, Mr. Greeno, I've done my homework here. I've done a lot of homework. And we don't want hypoxia, lack of adequate oxygen, in these kids, and we don't need them having a fogging brain or lethargy with these masks. These masks aren't lightweight, and it's hard to breathe in them. So I'm looking at every precaution here, and we don't need kids to be sick in the classroom because of these masks. And I think people should really take a look and see what happens with the CO2 levels when we wear these masks. I think I'm finished with that, but if I can get an email on where to send some of my studies to, that'd be great.
All right. So
Appreciate that.
yeah, that would be Ren Baldwin, who is our Deputy Health Officer. And again, I'll send all of the follow-up to
Okay.
Dr. Mosley.
And if you could send the email to the board, that would be great. Thank you very much.
Thank you, Ms. Johnson. I have Mr. Norris, Mr. Gao, and then Mr. Guarino. And then I have a couple of questions whenever. Thanks. Go ahead, Mr.
Thank you. So I just have a couple of questions. So the first one is going off what Miss Brown said. I know she talked about how in the winter, like when flu season hits, people were saying, oh, it's going to get worse as the cold weather comes around. I know a lot of colleges have opted to have students go home for Christmas break and then or Thanksgiving break and then not come back until after February. So do you see that as an option that would limit COVID cases effectively, or would it just, we'd be better off going the module 2 the whole time or whatever?
Anytime that you can have people space themselves out distance-wise, it's going to be safer. And so because we do know with flu season, influenza-like illness, that's another opportunistic infection that will be occurring around that time. The colleges that do decide to do that, if they can, I think that's a good measure.
And something else. So obviously, I think if we go back to this half and half or whatever, where kids are in school, I think it's inevitable that someone's going to get it, whether it's a staff or student. So like, what would be the protocol, or what would be an effective protocol? Because I know some people have been talking about, oh, everybody they've been in contact with quarantine for 14 days, but then that kind of defeats the purpose here. So like, what's your idea of an effective protocol for that, I guess?
So that's a good question. Thank you. So what we do currently right now is that if an individual presents with influenza-like illness, COVID-like illness, and they're diagnosed as a case, then what we do is an investigation. We identify all of the contacts. And I think, in some of the recommendations, without having people move around as much, if they can stay like in a classroom for the time that they're, on campus or, in the school, and not moving around from class to class. If there's an individual that does come back positive, we can really look at just that classroom for contacts, and then monitor those individuals to see if any of those individuals come back with symptoms, and then also recommend testing for that group of individuals. And so by having folks not move around as much, you're really containing your exposure or opportunities for exposure by limiting the moving around. And so that's what we would do. We would do a contact investigation of all the people that were close, to the student. And again, that's why the distancing is important, and wearing of the mask when you can't social distance. So when you're the thing about the mask, really, it's when you're less than 6 feet apart is when you want to have those on. If kids are spaced enough, far enough apart, 6 feet or more, I would say 6 feet or more, then the mask, may not have to necessarily keep those on all day. It depends on whatever the protocols the school actually comes up with regards to that. But it's really the social distancing that helps protect and reduce the exposure.
So I got one more, if that's all right. I know, going off what Ms. Johnson said, have you heard of widespread complications with breathing under the mask? I know, like, I've done some research, and even with people with asthma have been doing like air pressure levels or whatever, oxygen levels within their masks, and it's come back pretty consistent with or without the mask. So I wonder what you have heard based on that.
I haven't read any research on there being a widespread problem with wearing the mask. I haven't. There are some people who can't wear the mask if they have chronic obstructive pulmonary disorder or emphysema. Those are individuals that a physician may not recommend that they wear a mask. But other than that, I have not heard of any outbreaks or widespread problems with large numbers of people having problems with the mask.
Thank you.
Thank you, Mr. Norris. Excellent questions. Mr. Gao had a follow-up, and then Mr. Guarino.
Great, thank you. I'm back for round 2 of questions. This is a pretty quick one, but I just want to follow up on my previous questions about the data. I quickly went online and I looked at the 2 sheets that you shared with us earlier today, and I was wondering whether I didn't notice like the number of contacts that every COVID patient had. I was wondering whether that piece of data is there somewhere, or whether it's like somewhere in the Department of Health somewhere. The reason I'm really drilling in this area is because I kind of agree with Stephen that looking at the numbers right now, unfortunately, I wouldn't be surprised if there was just one case in the schools. And if there was one case in the schools, what I'd really like to know is how many more cases would that translate to? Would that mean like another 5 people or another 20 or another 30 people? And all of a sudden that could just exponentially cause problems, which I really would not want to have. So I apologize if I'm really just.
No, you're actually asking a really good question. So I can tell you, and it's a case-by-case basis. So we are investigating what we call a small cluster right now, where there were 3 individuals that went to a pool party together. When we investigated their contacts, there were 27 contacts as a result of those 3 people. So it depends on the activity and what they're doing. And so your school setting is a setting where there's a large number of people. And so you can have the opportunity for greater spread. If the classrooms though, and I think you guys are going to investigate this a little bit more. If in the classroom setting, if folks aren't moving around from class to class, but if a class is stable, say there's 12 students in a class on one particular day, and those 12 students are all in that class and they don't go switching up around, right? If one person in that group comes back positive, if they've maintained their social distancing in that classroom setting, the risk is lower, right? And so you're only going to be looking at those 12 folks that were around that individual. If there's more crowding together and people are moving from classroom to classroom to classroom, so that say that one student went from class A, then class B, the next period they were in class C. So now they've moved around. They've had a greater opportunity to expose more people by them moving around. So in the scenario that I gave you, all the people that were at the pool party, all the folks that were there were just in that one place. And so what we look at is that pool party, we identify all the contacts there, and then we identify any other contacts that those individuals may have had in their home, right? And so then we come up with, we get a number out of that. And so it's usually the immediate family that's there, and in any other social place that they've gone to is the numbers that we've come out with. So it's a case by case scenario. So that's why I said our epidemiologists would have to go back. We have this database, it's the New Hampshire syndromic database. They can go in and there's all the cases are listed, and you can go in and you can pull out different cases and you can look at all the number of contacts for each of those cases, right? So we can do that. We can do a cohort study of, say, randomly choose a certain number of cases out of that database of you saw the 3,000, well, we're up to 6,000 cases. Of the 6,000 cases, say we go in and look at 100 randomly, we can also go in and see all the contacts for those 100 people and look at what that number looks like. So you're not going to see it on that spreadsheet there because we have not picked up that project yet because we're doing all this other stuff right now.
Thank you so much. I will definitely check that out. That sounds really interesting. Thank you.
If I could just interject, I think one of the challenges about, we talk about the class settings is that it's not so much the class setting, it's the reinforcing of the social distancing. And some of our kids at the high school, I wouldn't worry too much about, but I think some of our elementary kids and some of our middle school kids would have some challenges with that. So it's important there's a level of self-regulation. So there's going to be some practicing some techniques. Some of our kids have trouble with that. And there are some challenges around that. I think that it's important we can put all of the rules in place, so to speak, but it's the enforcement of the social distancing that presents challenges at our schools.
And may I add one other thing, Heather?
Yes, please.
And the other piece of this is that you want to make sure that, I know that a part of the model has the screening, right? So that the parents are going to be screening kids before they come to school, or making sure that kids don't have fevers, that they don't have signs and symptoms, and not sending them to school. That's also going to be really, really important, that kids that are sick actually do stay out of school.
Thank you, Ms. Bagley. Thank you, Dr. Mosley. I have Mr. Guarino as next.
Thank you. Thank you, Madam President. I listened to the healthcare expert, Ms. Bagley, and I will defer to them, but I am very skeptical about any studies. I question those studies that say that masks aren't good for you or they increase CO2. I wore a mask for 4 hours doing volunteer work. The air that you need to breathe goes in and out through those masks. Doctors wear those masks for hours on end when they're doing surgery. Now, if they affected your oxygen level, obviously a doctor performing surgery for many hours would be impaired. And so they know what they're doing. The healthcare people know what they're doing. And so I would be very skeptical of those studies. And like I say, I defer to the health experts like Ms. Bagley, but I think we have to be very careful about these studies and the source, where they come from. We need to check our sources. Thank you.
Thank you, Mr. Guarino. I think it's very important that Dr. Mosley invited Ms. Bagley to come tonight because she's our resident expert, and I really think that we ought to be leaning on her and relying on the data that she is bringing us. So Ms. Ziem, did you have any questions for Ms. Bagley? I can't hear you, Sandra.
Oh.
Oh, nope. Sandra, you keep popping in and out of mute. I'm going to go to Miss Oden.
I just want to thank Miss Bagley for coming. I thought she had an excellent presentation. So I just want to say thank you to her.
Oh, you're welcome.
All right, thank you. Dr. Mosley has his hand up.
I just have a couple questions for Ms. Bagley.
Okay.
For clarity purposes and just for the public. So what I'm hearing is that as of right now, starting at a hybrid model of moving in that direction, but also being prepared for a spike is the appropriate recommendation coming from the public health department from the city. Is that correct?
Yes, sir.
Okay, thank you. Second piece is that, can I just talk about PPE equipment? In addition to the mask, are you also making recommendations to protect our eyes as well? Because the research suggests that COVID-19 can also be spread through droplets exposure to the eye. Is that correct?
So that is correct. And so again, that's why we recommend the social distancing. And in cases where they're starting to come out with some really good personal protective equipment. I actually sent an email to Ms. Hines that showed that there's a new type of face mask that they're recommending for the schools that actually go all the way down here. And the reason why is because it's actually covering, the mouth that goes down. So the mask that we wear typically will cover from around here, from our nose all the way down around our chin. And so the mask that I showed her that I sent in covers from here all the way down. So if there are, those types of personal protective equipment that the school can purchase, that might actually work. One of the things that they have, talked about, since we're such social people and it's really important with engaging to be able to see the mouth, and especially for kids that may have
hard of hearing.
Hard of hearing and they need to see the mouth. They actually have masks now that are clear. And so it covers everything here, but it's clear so you can actually see the mouth. So this takes away from some of the communication that we like to have as people. We can see the eyes and you can see the eyes smiling, but it takes away from some of this other part that helps with our social development, right? And so there are lots of different types of supplies that we might want to think about getting for, the different learning needs, that kids have. So those things are, and I will keep sending you those types of things as well. But these masks that we're recommending, these cloth masks, they're 2-layered. They need to be 2-layer thick. They can't be the mask that has a little opening on the side that allows for air to go out, because that's defeating the purpose. You're letting the droplets out. But these are double layered. These are very thin. They're very comfortable. We can actually give you all some of these. You can see our little logo on there. Give you all some of these so that you can have them. But you can hear me clearly. It's not restricting. They can all be different. The N95 masks are the ones that that they're using in the healthcare arena in the hospitals, and they need to have those. They are airtight around the face. They have to be fitted specifically for each wearer, and they're designed like that intentionally because in the hospitals they're working with things that are flying all around, and they have to make sure that that doesn't get into the practitioner's nose and mouth, and then they have the mask on as well. The students will not have to have a mask and a face shield. They won't need to have all of those things on them. One or the other would be preferable. And if you're doing that social distancing, unless a person is like spitting, those droplets are not going to fly, that far that you have to have, the face shield on. But it is something that's an alternative to wearing the mask because you can see everything, full face, you can see the smiles, you can see all of the gestures that are, that we use in our human expression, which are really important for learning.
And my final question is, you mentioned the strain that's here. Is that the strain that's been reported that the COVID-19 has some permanent effects, particularly on the brain and on the lungs? Is that strain currently active here in New Hampshire?
Dr. Mosley, I think all of the COVID-19 it's in itself affects multiple organs. When I say the strain that in the U.S. is a little bit different, it's because they're saying that it spreads faster. Is what they're saying. The difference between the Wuhan and the Italian strain is that this one it doesn't seem to be more virulent, because sometimes viruses can become more virulent and they kill you faster.
Yes.
It doesn't seem to be one that's more virulent that'll kill you faster, but it's one that spreads a lot quicker than the previous two strains. And I'll see if I can find the source on that, but I haven't heard that it's any different as far as the impact that it has on our different organ systems. They, depending on the person, this virus can attack all of our important and major organs, from your lungs, your respiratory, to your digestive, your kidneys. It's a multi-system impact that this virus can have on people.
Thank you.
Thank you, Dr. Mosley. I want to see if Sandra Ziem is able to speak now, and then Ms. Johnson, I'll get you for the follow-up.
Can you hear me?
Yes, thank you, Ms. Ziem.
Yeah, as you can tell, I'm not very good with computer. I have two questions, but I don't think those questions are necessarily for them. I wanted to know about, there was some talk about a parent choice option, and I would like to know if there were any cons that should be, that we should be aware of. And then I also, that's
Nope.
this time it's not mine. The other ones were all mine. But anyway, so that would be one of them. And then there's been no mention of checking for the fever. Are we planning on checking all of these kids for fever as they come in the door in the morning? And if so, how is that possible?
Can I answer one of them? Or
Oh, hang on one second. I'm going to ask Ms. Ziem to put the parent choice question on the shelf until we kind of get there. Because with Ms. Bagley here, I'd like to stick to the public health kind of questions first. But regarding the fever, is that something, Ms. Bagley or Dr. Mosley, that you could answer now?
I mean, I'll defer to Ms. Bagley, but at this point, that would be a public health question, but particularly for our nurses that work within the schools. So that would be my guess, or a recommendation for appropriate reaction. But I'll certainly defer to Ms. Bagley if she had some thoughts around that.
I would say that unless you have your nurses are going to be checking if there's a child once they're at school, if they present a particular way, that they will monitor for temp. I would think that you would want for the parents to do that prior to sending the kids to school. I don't know if you want to set that up as something that's done for every child coming in every day. I would think you would want the parents to screen their children before they come to school to make sure that they're not sending them to school sick. Because if they have a fever, by the time they get to school, they've already exposed, folks.
Okay, and that makes sense. Dr. Mosley, do you think we will get back to Ms. Ziem's parent choice question?
Yes.
Yes, okay. I don't want to lose track of that. And then Ms. Johnson had a follow-up question.
First of all, I just want to clarify on my masks. Ron Paul is a doctor, so it came from the Ron Paul Institute. So I do respect him as a doctor, and he's a former member of Congress. So I believe in that. What he says, I just don't read everything, and I read the CDC, I read from epidemiologists, from pediatricians, so I do my homework quite well and see what everybody's saying as far as students going back to school. Some pediatricians say it's, let me see where my notes are. Benefits of students returning to school outweigh risks, pediatric groups say. So, you know, I'm just not nilly-willying things. And I hope, and this should be even without COVID-19, that you hope that if parents have their children get up in the morning and they don't feel good, that they wouldn't send them to school no matter what. I know that sometimes doesn't happen, but, you know, that would be the best thing. You know, if you don't feel well, you don't go to work. If your kids are sick, you don't send them to school to infect everybody. So that's just common courtesy, common sense, and that's, I guess we have to make it a little bit tougher this time with COVID-19 and really tell parents, you know, if your children have these signs, then please don't send them to school. We don't need to get everybody sick, but I just wanted to clarify. I don't want people to think that I just pulled things out of the hat on my research, but this is from Dr. Ron Paul and his institute. Thank you.
Okay, thank you, Ms. Johnson. Does anyone else have any questions for Ms. Bagley? Ms. Brown?
Thank you very much. Ms. Bagley, thank you. I love that you're so responsive to all of our questions, and I'm really glad that you recognize how badly the kids need to be back in school and to be back together for their social development, and starting to recognize facial cues that are going to help with their speech and all those kinds of things. And I was wondering if there's anything within your COVID task force that you've been looking at a correlation between any kind of a rise in like youth anxiety disorders or depression or abuse or any kind of those other, I guess, side effects of what could be going on right now?
That's a good question. And so we do have one of our staff, our substance misuse prevention coordinator, has background in mental health. And so a part of what she's been doing is some groups with parents. And she actually had a podcast where she was meeting weekly with parents to learn about what are some of the things that are affecting the kids right now. We haven't gone through that data, but you bring up a really good point, and that is something that we do need to look at. We do know that the stress, COVID-19 has really exemplified a lot of other things that we tend to pay attention to regularly: adverse childhood experiences, depression, increased rates of suicide and substance use. We are looking at those things. I don't have any data that we've been able to analyze to give you numbers of what we've been seeing, but we have been hearing about the impact of the isolation and the separation that kids and families have been going through. We do have a survey that we are collecting that information on. We haven't analyzed it yet. It's a part of our community health assessment. We're trying to get at least, I think we're trying to get 350, if not 400 surveys completed. We're halfway there. Once we have all that information, that will be something that will be presented in our community health assessment. Our data analysis, we have a timeline. We were expecting to have this work done and completed by October. It will be well into the school year, but that's when we'll have that data analyzed on feedback that we've gotten from our community with regards to that question. We don't have that right now, so anecdotally, Lisa could talk about what some of the parents have shared with her in some of her podcasts.
Thank you, Ms. Bagley. Oh, go ahead.
I'm
Ms.
sorry,
Alden.
Miss Rame. I just wanted to ask Miss Bagley, should a student be sick, would they go to the health department to be tested if they have some of the symptoms? And how long would it take to get the results back?
So if a student is ill, is this once they're back in school, or is this at any time?
Yes, when they're back in school.
So if a student is ill and they need to have a test done, they can do that a couple of different ways. Their parents can either have that done through their provider's office. They can have that done through Convenient MD, CVS, or we've been doing testing clinics. We've been holding them once a week for the majority of the summer. This past month, we've started on Tuesdays and Thursdays. So an individual can get tested here as well if we are able to continue those clinics during the school year. If not, then it would be recommended that they go to their practitioner if they have one, or CVS or Convenient MD. So if we're offering them, they can get the test with us. And the only reason why I say if we're offering them, because of once the fall season comes in, hopefully, we kick off our vaccination clinics, and we probably won't mix the two of those together. So that's a conversation that we'll have, with the health department on what we will continue to do in the fall. More than likely, we'll still be testing.
Thank you. And how long would it take to get the results of the test?
So right now, we're able to get the results within 48 to 72 hours, but all of those things are kind of fluid. The more testing that's done, the longer the labs take to run the test once we send them up to the labs and for the test results to come back. So right now, things have been going really well for us. We've been able to get them back in 48 to 72 hours.
Okay. And let me ask you, I'm sorry, one final question. If they go to your department, is there a charge for the test?
All the testing that we do is free.
Okay. Thank you so much.
You're welcome.
Thank you, Ms. Oden. And thank you so much, Ms. Bagley, for coming out this evening and joining us. I really appreciate all of the data that you've shared with us, the websites that you shared with us so that we can get more data and your recommendations going forward. I don't know if anybody noticed, but I took a lot of notes and I feel like I've learned a lot. Thank you very much.
Really great.
You're
Thank you.
welcome. Thank you for having
Thank
me.
you.
And thank you for all your questions.
Great. Thank you. All right, Dr. Mosley, was Ms. Hines, were you waving for attention or waving goodbye? Okay. All right. Dr. Mosley, I'm going to turn it over to you. We kind of went a little out of order on the agenda, and so I will let you tell me where we're going next.
If I could just, I'm going to share my screen and to share that with the board. Can everyone see that? The PowerPoint, can everyone see that?
Yes. Yes, thank you.
So just so we're clear into the public, the purpose of this presentation is not for the board to make any decisions. We're just giving updates to the board. Second thing is that, as we know, and what the recommendations coming out of the public health department is that model number 1, as of right now, is out of the question. So it's not something that we're going to entertain or explore. So we're going to talk a little bit about what that feels and looks like, and then we'll open it up for questions. I have Ms. Giglio that's here, Stacey Hines is here, Lisa Gingras is here, and Gabby's here, and Tara's here. So my screen is looking down this way. For the public and for all that are watching, this isn't about keeping just kids safe, it's about keeping kids safe, our faculty safe, our administrators safe, our community organizers that come into our building safe. This is about everyone being safe and being educated and working in a safe environment. So when we look at these recommendations, we're looking at public health recommendations, we're looking at what informations and themes and patterns as we look at the data. The second thing that I put this out there for the public. We ended school about 2 weeks-ish ago, and since that time, we have been, we distributed survey, excuse me, let me back up. We have forms our reopening task force that consists of 26 members. We also divided and have subgroups of that task force. Let's just jump down here. That task force has subgroups that range from remote learning, school personnel, plant ops, food services, totaling 17 different subcommittees. And that has taken place over the last 2.5 weeks. When we first proposed this to the public, we outlined a timeline that really started around March 27th. And if you can see here in the red, this is where we're at right now in terms of reporting back. So we're, what I would say, on target in terms of reporting out and getting information to the public and to the board. So again, as I said earlier, we had 17 subgroups: plant ops, school medical personnel, district leadership, food services, remote teaching and learning, professional development, human resources, technology, CTE. I'm just highlighting some of them: summer school, preschool, communication. And I just want to just take an opportunity to thank all of the teachers, administrators, faculty, Sharon, any board member, Jessica, all of the individuals parents who have volunteered their time to give us the feedback from these subgroups. What I'm going to talk about now for the public and for the board is just some data that we collected. To give you an idea, we had very participation for our qualitative and quantitative data. I'll talk a little bit about the quantitative data, and then I'll talk about the qualitative data later on in the presentation. So to give the board and the public an idea, the surveys that we made available to the public, we had, now just so the public is clear, we had approximately 534 teachers that participated out of 1,005 teachers, which is about half the teachers. We still haven't gotten the data back from the parents yet. Students, we only had 124 students answer out of 11,000 and some change. For administrators, we only had 45 that responded out of the 87, which is about 52%. I just want to make it clear for the public and for the board, this was an online survey. And so the validity in terms of were there really, I'll just use the teachers. Well, I'll just use, if there were 300, we can just assume that there were 534 teachers that participated in this. Again, it's not something that we want to, it's just something to consider when we start to look at this. Okay. Now, this is a chart that we put together during our last presentation. So if you can look at this, and for the public, it is a survey results, subgroup data that we had. Now this is different, and this is different because of the information that Bobby Bagley shared with us, but also the patterns and the trends that are happening right now. The reopening task force will generate recommendations under model number 2 and not model number 3. And that's very important, because what we're saying here and what putting out there, but based on the data and epidemiology, that right now we're going to focus on moving towards a hybrid version, with the understanding that we should be prepared as a district to turn on, what I say, a dime in an event that we see a spike or a significant increase in COVID-19 cases in our district. And finally, we're going to present that information to the board. Some of our survey data that we had, and all of this is going to be provided to the board, to the public to review. This is our way of highlighting some of the trends and patterns that were significant. All of it is significant. What we used is a barometer of what we say 75-ish % or higher. We thought it was significant enough that we would report it out to the board and to the public. And what we, for question number 5 for the teacher survey, we noticed that about 91% of the teachers really wanted to have augment their professional development knowledge on remote learning and online resources. And that's just a credit to the teachers just wanting to be continuous learners, and that's to be expected. There were, for For question number 8, my administrators were responsive to me when I had questions about remote learning. 84% of the teachers felt that their administrators were responsive to them during remote learning. And my administrators were responsive to me when I had questions about grading. And so we saw that coming from the teachers at a score of about 83%. And I say ish because it's always plus or minus. For our administrators, again, 45% of them respond. We had 45 administrators. Some of the significant percentages that popped up for the survey. And when I say this, I just want to be clear for the public, when I'm using 85% or the numbers to the right here, that's under the umbrella of strongly agree and agree. So the way to read this is that I have the necessary technology and equipment to work from home remotely. 89% of the administrators strongly agreed with that statement. I'm supportive of students and staff wearing protective masks and practicing social distancing. And I'll get back to that question again, but that was 73% of the administrators said that they were supportive of that. Jump down to the students. There were, again, only 124 students that responded to the survey. My teachers were available to help me with my assignments. 75% of the students strongly agreed and agree with that. Teacher assignments were easily accessible online. 79% of the kids agreed with that. My teachers were flexible and allowed me opportunity to improve my grades. 75% of the kids responded strongly agree. My parents were able to provide me with academic support at home during remote learning. 79% of the kids said they strongly agreed and agreed. And I'm supportive of students and staff wearing protective masks and practicing social distancing. 60% of the students responded strongly agree and agree. And I just want to know, and I know we have to recognize that there are some flaws in that. And number one, it was only 124 students. Number two, some of our kindergartens, first grade, second grade students probably did not respond to the online survey. So we just have to acknowledge that. But it just gives us a flavor, a flavor of what people were thinking in terms of remote learning. I think, one of the things that the question that I think kept coming up during the discussion, but it also kept coming up during our discussion when we were talking about is this protective gear, protective mask. I mean, this is essential. I mean, we heard it from Bobby Bagley, it's CDC recommended. And so we have to think about that. And so we, again, just pulled that question out and we just saw how the students responded, the administrators responded, the teachers responded, and we still have to collect the data from the parents and the staff. But it just gives us an idea of just getting a feel of the temperature of how our kids and our faculty and our teachers would feel about wearing masks or protective gear. So what we did is that question number 8 in the survey really was a rank order. Basically, what is the most important materials, resources to you as an individual, as a teacher, as a parent, as a student, as an administrator. And there were 2 things that kept popping up across all of the surveys. And by far it was internet access and possession of a computer. I color-coded this for the public and for the board only because, and I starred the internet and possession of a computer. I did that because those were the 2 responses that generated the most significant gap between the rest of them. I'd say the next one was directions for parents to get extra support or information, and then consistency for students' expectations for work. And I put in parentheses a little more. I put in a little bit more than directions or access to the curriculum. I just want to stop right there and say by far, I would probably say, and again, I'm not a mathematician or a statistician or whatever, but I would just say that there wasn't that significant from I would say probably from 4 down to 9. The significance in terms of what people ranked order or what they valued was not really that significant. By far, the internet accessibility and possession of a computer by far was one that popped up across pretty much all of the subgroup. It also popped up during our administrators. And again, these, I'd say from 3 down to 9, there wasn't that significant. By far, the internet accessibility and possession of computers were definitely number one and number two. Students also felt the same way. Internet accessibility and possession of a computer by far were essential themes in terms of what they valued for the remote learning, but also for looking at models in terms of being successful. All right, so the question is, we got this data, we got all this information from the subgroups. What do we do? How do we move forward? There's just so much information. We also know, thank you to Bobby Bagley and to the numbers, that we're ruling out model number one. We also know that now we're just dealing with model number two and model number three. And ultimately, we want to be able to transition into model number two, but also keep in mind that we as a district need to be able to, what I call, turn this ship around just in case and go remote in the event that there's a high spike or anything that happens in our district. The other thing that is, when we go through a hybrid model, and Lisa Jingers pointed this out to me, it's not about just going 50%. It's much more complicated than just doing a 50% number out there. I put that out there before when I presented about 3 weeks ago or so, but it can be a slow roll into a hybrid model. And that's all dependent on grade level. It also depends on teacher, and I'll get to teacher readiness in a second, but it also, and it's also contingent on parents as well, and also our students. So let me tell you where I'm going with this, or we, and Sharon, please, if I'm talking too much, you just jump in and just tell me to be quiet.
Dr. Mosley, actually, can I jump in? Your screen is not being shared to the public right now because the font is too small. If you go to the slideshow mode,
Oh, I'm sorry.
it might show up. I didn't want to like interrupt you mid breath.
Can you see
Okay.
that?
I don't know yet.
Okay.
Hopefully ETB will let me know if that is working.
I'm sorry.
Yes. Okay. Yes. I hear yes. It's back on.
Okay.
Okay. Excellent. No, but Gloria says no, not yet. Oh, there's a delay. Okay. I think we're good. Are we good?
I'm waiting for you, Heather, to give me the single.
Yeah, I'm waiting. I got a thumbs up, so I think we're good.
Okay. So here's what we're thinking as
Thank you.
as a group. Number one, we still need to synthesize the subgroup reactions to the questions according to model one and according to model three. The deadline that we proposed was Thursday at 12 p.m. And I just want to say again, thank you to those subgroups. When you originally put questions together for subgroups, you're thinking maybe I'll get 2 to 3 bullets per question. And honestly, that's not what we got. We got a lot of information. Some of this, and I'm not making, it's over 400 pages of just information, Sharon and Tara and Gabby and Stacy and Lisa. Is that correct?
It's amazing. It's amazing how much, the incredible amount of work that the subgroups put into this, and the detail in which they looked at every single aspect, beginning when the students were going to the bus stop and looking at the staff and students throughout the whole school day from all different lenses, from all different perspectives. And I was just amazed by the degree of detail that we got and all the hard work that went into it.
So all that's going to be released by, I would say, hopefully by either tonight or by tomorrow. There's a lot. And in fact, it's not something that we can email out because it's just too large. We actually had to create a database to house this for people to look and review. The most important thing that I want people in the public to understand is that we're only at this point examining our hybrid and remote in-person learning and our remote one for moving forward. Second thing I think it's important as we start to talk about this is that we have to look at developing an online platform for students and teachers to operate from what I call a choice model or educational engagement. Sharon, did you want to talk a little bit about the what we're planning on doing is having a parent survey sent out to our parents to gauge what parents are going to or willing to send their kids under a hybrid model, and also, well, I'm being quiet. Sure.
Yes, we feel that it's important because some of our parents may have children that they feel should actually stick with remote learning for a while for health and safety reasons. And so the survey is going to help us get some kind of number of how many students would not be opting to even go the 2 or 3 days a week or however the hybrid model goes. We also need to find out which of our teachers have serious health concerns that would make it better for them to be involved in the remote teaching rather than in classroom teaching. And so those surveys are going to go out, I think, this week, right, Dr. Mosley?
So just for the teachers, it would be a dialogue with the union and staff to design an equitable schedule and preference. Also, too, there's some prepper things going on too with our faculty that we can't send out a survey say, hey, do you have these pre-existing conditions? We just can't do that. But we'd have to work with HR, with our faculty. And I know the faculty are very anxious about this, but we are going to work with the faculty. This isn't about about a mandate coming from XY. It's important. Your safety is just as important as anybody else's safety. And we want to make sure that that's echoed out there. The other piece to the faculty too that you should know is that we also recognize as a district and as superintendent that you have loved ones and family members that have pre-existing or are very highly susceptible to COVID-19 illness and the virus. And so we want to make sure that you're not going to be absent in that discussion, but at the same time, it requires a lot more of a dialogue around that because it's just some FERPA requirement. I'm going to jump back to the next steps. One of the things that popped up, I think it was Sharon or Tara or Gabby or Stacy. We really talked about when we looked at this last experience, and I think Jessica Brown mentioned it around services around kids and their social emotional and the trauma that some of these kids and the depression that can happen. And I think we really want to start bringing in and coordinating that childcare, the coordination of DCYF services and making sure that if we do go a hybrid or we do go remote, that these agencies are better connected to some of our at-risk kids. And that's very important. The other piece that we thought about is the childcare, which is very essential. And so we're going to bring in the Boys and Girls Club, 21st Century, the YMCA, the Arlington Community Center, because if we do go hybrid, we're going to have there's a child care piece that needs to be coordinated citywide, along with our transportation as well. One of the things that popped up during our survey, but also during what I could read through our subgroups is that our parents, because we're in this hybrid, they want more professional development on online platforms and resources. As much as I'd like to say I'm the most educated, I have a lot of education, I still have some trouble navigating Google Docs. And I think only of our parents have trouble navigating some of our online platforms, whether it's Google Classroom, Zoom, or any other survey, any other online resources that our parents are looking at. We also noticed in some of the survey results, as I mentioned earlier, not that professional development will extend to our faculty and our students, faculty and our staff, because we recognize that they also ask for that level of additional support and review for our online resources and materials and academics for them as well. Connectivity, again, that's very important both for our faculty and for our students. And I think the number one thing, and this is where I think is the real challenge, is the logistics, scheduling. Scheduling this hybrid for in a district this size is a prodigious undertaking because we have so many different programs, so many elementary schools, coupled with that choice component for our families. I think that it's going to take some time to do that, to develop. But we also want to have some form of uniformity and consistency and equitable throughout the entire city. And the other challenge is, I can't thank the people that have been with us this journey, everyone, the whole district, the parents, the administrators, teachers, union leadership, all of them, they've been great. It feels like we just got out of one storm and we're heading into another one as the summer starts to quickly slip away from us. So that's a challenge. Kind of some final thoughts and then open up for questions. Remote learning, Remote learning will look differently at different levels. We've already experienced that. A hybrid would look differently at different levels because of the kids' developmental, because of the developmental age of some of our kids. We ask people to be flexible and practical, understanding during this time. I'd like to just say Lisa Gingras has been waiting patiently. And Lisa, would you like to add anything onto the extracurricular?
Just real quickly, good evening, everybody. Dr. Mosley had asked me to join you this evening just to, as we start talking about reopening our athletic programs, is the first thing that has reopened in some form or fashion since March. So just wanted to give you a little update since the last time I was with you. We did start last Monday, July 6th, with some of our summer workouts. We have 13 programs running summer workouts right now. We have 6 different sports at each high school, and our cross-country programs in our 3 middle schools are kind of working together. So between our on-staff coaches and volunteer coaches, we've been able to have 36 different cohort groups working within the past week. A few more cohorts are looking to start up this week. And I'm hoping the final week of July we'll be able to move into phase 2 with larger groups and hopefully adding in the weight room and the gyms as we talked about last time. And I know we have several more sports looking to open up at that time. So just a quick update on something that has started at this point, and hopefully when my subgroup specifically was the co-curricular and athletics, and we included, band and chorus and drama and student activities in addition to athletics. So our subgroup has a lot of information on how those things can take place and exist in both the remote and hybrid models.
Finally, we just ask people to be flexible. Right now we're focusing on just 2 models, and that's being able to, depending on the trends, moving from one model to the next. Sharon or Cara, Gabby, Stacy, or Sharon, anything else that we missed or like to add?
No, I just, I think it's wonderful that we're going to be able to share the information that was gathered. And I got the first subgroup report back. I thought I'd be reading it for maybe 20 minutes. I spent more than an hour on it. And that was just from one of the subgroups. The amount of detail that they went into looking at every single aspect of the school day was amazing. And I don't know where they found all the energy to do that much work after just finishing the school year that we just ended, but they did. So thank you.
Okay, I'll jump in. Thank you very much, Dr. Mosley and Ms. Giglio. Thank you, Ms. Gingras, for giving us an update on athletics, and Ms. Hines for all the work that you guys have put in so far, and all of the subgroup members. I know that summertime is a busy time for everybody, and I really appreciate everybody taking the time to really think about how we can make school happen for our kids this fall, one way or another, to make sure that their needs are being met. So thank you so much for that. I have a list of people with questions. I want to start with Mrs. Zeem because we had asked her to put on the shelf her question about parent choice, and I want to make sure that she got her answer during Dr. Mosley's presentation. And then I have Mr. Guarino and Ms. Brown.
The question.
I'm sorry, Ms. Zeem, I only got the end of it. Was your question answered?
Not really. Can you hear me?
Yes, I can hear you now.
At least maybe they did and I didn't get it. I hope not. I asked what are the cons of letting the parents, one of the emails we got was very interesting. I thought it sounded like a good idea. It talked about parental choice. And so what are the cons to parental choice was basically my question. I don't think you answered that, but if you did, I apologize.
I think the cons, the pros, I guess I'll just start. The pros is that we give parents an option. We give parents an option, and we also comply with their wishes to educate their students in a whether it's a hybrid or a remote setting. The cons is that there could be a disproportionate amount of parents that opt for one option, and then there's not enough teachers to house that, and then that could be a staffing issue. The cons could be that maybe, setting some policies around that. At some point you have to make a decision whether you want to go hybrid or remote. I think the cons in all of this is that our kids are not going to be able to go back in a normal setting, but we're making the best we can. So if there's a disproportionate amount of kids that choose one track or the next, it could have some financial implications around staffing. I'm just kind of going here. We could have a disproportionate amount of kids requesting to on remote parents, doing remote learning, or the other way around. Mrs. Eam, did I answer your question? Oh. I can't hear. Is it just me, or I can't hear Mrs. Eam? I can't hear anyone now.
She seems to have muted herself.
Can you hear? No.
Try again, Mrs. Ziem. Can we hear you?
It's not working.
I can hear you now, Mrs. Eam.
You can hear me now. Well, I don't know what I did, but walk away. You mentioned the financial implications. Was one of the subcommittees a financial subcommittee? You can't hear me, right?
What we did, Mrs. Eam, is the answer to your question is in all of the committees, we identify finance or cost for all of the subcommittees. So all of them have in their sections, if they made recommendations or found some issues, they were able to identify the financial cost of what they were proposing. There wasn't one subcommittee for finance, but there was a section in all of the subcommittees that dealt with finance specifically around cost.
Thank you. I just have this feeling that it's going to be awfully expensive. Thank you.
Thank you, Ms. Dean. Okay, Mr. Guarino and then Ms. Brown.
Thank you, Madam President. I just want to thank Dr. Mosley for this presentation. It was very thorough and it was well thought out. And I want to thank everybody that worked on the committees, Ms. Giulio, and everyone else who helped with the
Thank you.
With the information. I took the survey as a parent. I thought it was put together with safety first, and I think that's very important that people should understand that. That was the first priority, was everyone's safety. And I like that. I just want to ask if this presentation and maybe some of the survey results going to be available to the public, or maybe they're already available to the public.
Yes, all of that's coming out. We didn't want to just, the challenge with data is that you don't just want to throw it out there
Right.
because then it doesn't have a narrative to it. So all we wanted to do is, before making it public to you or just to give kind of a conceptual model of what we looked at, a narrative of what was represented, and also some of the what I call flaws in the survey. For instance, like what I said earlier, when I use the word students, and that's only 124 students that responded to it. That's not indicative of the student population for Nashua. And same thing with and given that it was a online survey, we couldn't track who's actually really responding to it. Everyone being honest and equal, so to speak, we still have to acknowledge that half the teaching force did not, respond. And that's nothing negative. Some people are like, you know what, I don't need to do it. It's not a big deal. But we just want to acknowledge when I use the word teachers, we have about 534 teachers. But all that's going to be available. All of that's out there. I don't pretend to be a mathematician at all. This is stuff that we worked on starting on Thursday into the weekend, and here we are.
Okay, so the presentation will be online?
Yep. Oh, yes.
Great. All right, thank you. Also, I think Ms. Johnson wants to get in the queue, but she,
Okay.
yep.
Thank you, Mr. Gardner. I saw that. So it's Ms. Brown and then Ms. Johnson. But I did want to thank Dr. Mosley and Ms. Hines for committing to getting the PowerPoint up on the website because I know that members of the public weren't able to see parts of the PowerPoint, and I know that they want to. So I appreciate that. Thank you. So go ahead, Ms. Brown.
Thank you. I appreciate that, Heather. So I do have actually a couple pages here of comments. Thank you very much for the diligent work to put that presentation together. I do really appreciate it. I think it should be noted that right now, even though I'm a member of the committee, is the first time I've seen any of this data. I think that makes it really difficult for the subgroups to do their work. The fact that now there's 17 subgroups that are doing work, but there's not been distributed the information from the survey. And I disagree with Dr. Mosley's statement that we don't just want to throw data out there without a narrative to it. I think that's exactly the opposite of what you should do with data. I think data is valuable by itself, and then people can look for what they're search for what they're looking for. Next, I'd like to kind of reiterate, go back to the way we're surveying our audiences. I agree with you in your statement that when you have a small pool, it's hard to know if your sample is good enough or correct. But this is the third time during this short time that I've been on the board that I've recommended to you, and I don't know if this is Ms. Hines or Dr. Mosley, if this is your choice just because of how this is working, that we use a different survey method. The first time on the phones, that was one thing, and then we had the Google Docs or Google Forms is not a great method to use for that, but that's what we have. That's what we got to work with. And I was really bummed actually to see the slide 17, which was based on a ranking order. When I filled out the survey, I was even thinking, man, this really stinks because this is probably some of the most important information we need out of this entire survey. And you have to rank it in your level of importance rather than being able to give each choice an individual level of concern. I think that was not a very good method, but it's done. I'm also a little disappointed, and I think it's a little non-transparent for us to only show the answers that have high percentages. Were there any that came in at 15%? Are we looking at any that came in 62%? Yeah, that's a little bit getting close to the edge of whether that's a good sample and you can work against it. So I really think that the results of the entire survey should be shared, not just what's included in this presentation. But I do appreciate the people who have worked really hard to gather that data and the statistics to put it together. I'm a little disappointed that we still haven't seen the results of the parent survey, as the fact that came out. I think we took that survey in the end of June, and it's now near, what is it, the 13th, the middle of July, and we're supposed to be making a decision in a couple weeks. Getting crunch time. So that's related to the survey. And I hope that we can be transparent in this district with our communication and make that work. In relationship to compare the transparency in this group, I realize that there's a lot of information from a lot of different people and a lot of different people working really hard on these tiny groups working together. But there has only been one meeting of the full task force so far. The next one's tomorrow. And I haven't had any communications that I haven't initiated myself with the committee. And I think it's not good. I mean, how do we know that we're all moving in the same direction? We're all like these independent little pieces. And now we've only got, again, 2 weeks. And now it's crunch time. And so, committee, survey. Finally, I want to address the concept of a hybrid model. And, maybe this is just comes down to an issue of semantics, but think anything that is not fully remote and is not a full open of school would be included in a hybrid model. This parent-teacher choice option that they're utilizing in the city of Amherst, a lot of big, large school districts across the country, offers, I would still put that cat in the category of a hybrid model, because we don't have all the kids in school at the same time. I feel like it's being written off, and actually tonight in this meeting was the first time that I heard anybody use the word hybrid synonymously with only being open 2 or 3 days a week. I have great concerns with that, with not having some of our kids being in school full time, or I'm really nervous what it's going to do to our community. I am. And I know teachers want to work, and I know that we want people in this community to be able to have access to the educational materials that they need. And I know I'm not trying to make a pitch right now for what we need to do for everyone, because I think we do need to treat this on a case-by-case scenario, and we need to make sure that as many people as possible have access to the best learning materials and learning experience materials and personnel possible to meet their needs. So I would just would like to mention that in my mind, I don't see a hybrid model necessarily being defined as only in school part-time. Thank you. I guess I didn't really have any questions, just comments. Thank you.
Great. Thank you, Jessica. I have, I'm sorry, Ms. Brown. I have Ms. Johnson next. I know Mr. Garrido wants to follow up, but I'd like to give other people a chance to talk before we go to seconds. So go ahead, Ms. Johnson.
Thank you very much. Some of my concerns are going to follow up on Ms. Brown's. First of all, I asked at the beginning, I'd like to see the surveys, and I'd like to see the parents' answers. I think that's very important in making decisions. I know I've read some of the emails from the parents. Parents are saying they want the kids back in school. Parents have to go back to work at times. So, I mean, I think we have to look at this. I mean, we're being told that we're going to go the hybrid method, either number 2 or number 3. You know what? I want to see everything spelled out. I just don't, we're the board, and we're the ones that have to make the decision, and I just don't want to be told this is what we're going to do. I'd like to see the parent surveys. I want to see what the parents have said. I want to see what the teachers have said. You know, so that needs to be available to us, and I think it needs to be available to us ASAP. We're talking about coordination of childcare services throughout the city. Okay, how are we going to do the childcare services? Are they going to be at a group at the Boys and Girls Club, the 21st Century, the YMCA? I mean, it doesn't make sense with this childcare services if we're not going to put kids back in school. So how are they going to have childcare services if they're going to be in some type of a group? Then, let's see, the surveys. Hybrid open 2 to 3 days per week for kids to go to school. I don't know if that's going to work. I can't. So the school is not going to be open 2 to 3 days a week. It's going to be open 5 days a week on the hybrid model for kids to come in. Or we're going to be in, because that's what I just wrote, possibly 2 to 3 days a week.
So, Ms. Johnson, can you give Dr. Mosley or Ms. Giglio a chance to answer that question about what
No, I'm seeing
a hybrid
everybody's
looks
head.
like?
Yeah, I'm seeing the head bob, so that's why I kind of said, "Is that the answer?"
So, Dr.
Mosley
Mosley or Ms. Giglio, could you please explain a little bit more about what a hybrid model, like what Ms. Bagley was talking about, what you're thinking it would look like?
Sure. I think a hybrid model needs to be vetted out with the experts. And those experts are really the building principals, the guidance counselors, individuals that understand the function and I'd say the pulse of a school schedule. Also, a hybrid version actually might feel and look different at the kindergarten level compared to like a 5th grade class. It might feel different for a 2nd grade class compared to a 9th grade class. So no one in this presentation talked anything about making a commitment to 1 or 2 days. I also mentioned earlier when I first started that a hybrid model starting out may be slowly rolled in to our high schools and slowly rolled into our middle schools. So we just have to be careful about painting a picture of having 1 to 2 days. I wouldn't recommend that at this point. I would say that part of this process is that we would need some input and some support from the building principals. The second thing is, I said earlier, when we talk about the hybrid model, what that feels and looks like, we got to get a sense of how parents feel about that hybrid model. And to be honest and direct and to just be out there, our faculty means something. We have to take care of our faculty. And I'm not going to, as superintendent, I'm not going to put any of my faculty in harm's way or their family's way to open up school under model number 1. Their safety is paramount to me. So, and to our community, and our teachers and their safety and their loved ones come first. And we're going to listen to Bobby Bagley and what she had to share with us. And we're going to move forward with as a community to keep our kids and our staff safe. And also we have to be cognizant of their time. I just want to say thank you to the teachers and administrators and all of you who have put in their time and put their vacation on hold to be part of this 2-week journey. It just has been amazing. So to get back to the point, we have not said 1 to 2 days or anything like that. We've just said hybrid. We'll just leave it at that.
Okay, I've got some more comments. So now we're into we're in the middle of July. We need to get input from the parents. We don't know how many students are going to be returning to school. I know the Catholic schools are offering $1,500 off for tuition. We need to know how many students are returning to school. I'd like to know what your special ed program is going to possibly look like. Also, I never said that I would put anybody in harm's way. I'm reading information from parents that they would like to see their kids back in school, try to get some normalcy back. I guess I'll have to call the Amherst School District to see what their plan is, and I'll call around some other districts to see what they're planning on doing the hybrid models. But again, I'd like to see the survey. And so we're asking the building principals and all the the experts on how we're going to set everything up. So we have about 6 weeks probably before school starts opening up again. And I hope we're going to be prepared for whatever the board decides, but I'd like to see the surveys. I want to see what the parents came, and I want to know how we're doing the childcare services, because it doesn't make sense if we're going to be keeping kids out of school and then we're going to have childcare services, and how is that going to work? And is the district going to be paying for the childcare services? When Sandra said that some of this is going to cost a lot of money, there's a lot of money that's on the line here. And if we don't go back to school, are we going to get federal funding on all this? So I've got a lot of questions. I want a lot of answers. And because people ask me in the district too, what's going on? I go, I don't know. I can't tell you. The committees aren't done yet. So I hope we'll get the surveys as soon as possible. Thank you.
Thank you, Ms. Johnson. Ms. Giglio, do you have some answers? There were a lot of questions there, and I didn't get them all down.
Right. I just wanted to let Ms. Johnson know that I receive a lot of email from parents as well. And many of them do say, yes, I want my child to go back to school. And many of them say, I am frightened to send my children back to school unless you can assure us that you're providing all of the safety issues that need to be provided. And that, of course, is going to cost money, because no one's going to be donating masks and PPE equipment to the schools. So, that has to be taken into consideration. We're not the only school district that's going to need to spend money on that. All the school districts in the country are going to have to at the beginning of the year. So that's really all I want to comment on.
Thank you, Ms. Giglio. Can people donate PPE to the schools? I know that there are a number of mask making groups in Nashua, including like that are donating to the United Way right now. And the United Way, FYI, is out at farmers markets on Sundays handing them out.
We've had some people donate some material. They go so quickly. So yes, they can. We'll certainly coordinate that. But I would say the best person, if you were going to donate anything, please reach out to Dan Donovan, and he can coordinate that donation.
Okay, thank you, Dr. Mosley. That was a spur of like off the head question. Okay, I have a list going. I have Mr. Norris, then Ms. Bishop. So Mr. Norris, go ahead.
Thank you. So I just want to reiterate the concern with the parent choice and teacher choice model. So I totally agree with that. If parents don't want to send their kids to school and don't feel comfortable sending their kids to school, they should have an option to have their kid do totally remote learning. But I just think it's the chance that the number of students and the number of teachers is going to be enough to accommodate having a certain number of students home and a certain number of teachers home and a turn at school. I think it's so far-fetched that we need like a concrete plan that we know we can go into in the fall. And I think this might just be we're kind of just guessing on a limb out here. But I think if there was a more structured plan where we knew this is how many teachers we're going to have here, how many parents we're going to have here, how many students we're going to have each way, because I could see a situation happening where you have like 90% of the students wanting to go to school, but then some teachers who are more at risk because teachers are obviously older than the students are, and you don't have enough teachers to teach the students in school. And one other comment, I know we're talking about the hybrid model here. I think the hybrid model would definitely work for the elementary and middle schools, just because you're within your class for basically the whole day. And I think more importantly than limiting the numbers of the whole school is limiting numbers in a class, because that's where most of the transmission will happen, I think. So, but like at the high school level, I'm just not sure how that would ever be able to work, because if you're transitioning between class and class, even if you limit, say, juniors and seniors go one day, freshmen, sophomores go the other day, most classes are pretty, like, obviously there's some distinction within grades, but still majority of the classes are single grades. Thank you.
Heather, would you mind if I responded to Stephen really quickly?
Well, I'm asking people to let everybody have a chance before speaking twice.
Oh, thank you.
So I'll put you down after Mr. Guarino for the second time around. Okay, Ms. Bishop.
Hi. No, I switched because my audio is better on my phone, but my video is better on the computer. So I'm just kind of toggling in between, which is what you saw. I had a couple of questions. In regards to the hybrid, I think I kind of thought the same thing as Jess, which the hybrid was going to be a combination of what parents were going to be comfortable with in regards to how much time they were spending in school, if at all. I also, a lot of my decision, I think, is going to hinge on busing. I know that that's a problem with our district, getting bus drivers anyway, is if we do a staggered schedule, what that's going to look like. One of the things that Miss Brown had put in her email was about the students that do better, face-to-face school are the ELL students and the special ed students. I can see your point in that. However, it kind of feels like we're throwing our most vulnerable into the most dangerous situation. So I would hope that that's not the only option for these students to have. I mean, there are obviously subcommittees and a task force because you guys are all addressing these issues. But I kind of was looking forward to seeing all of the different roads that we could have gone down, not necessarily, you know, the options that we have. I was hoping it would be a bit more concrete. Are you guys close to having, I mean, you know, 5 typical days presented to us for next week?
Just so we're clear, and again, I'm going to just put out that we got to be flexible in a way where we are looking to make some scheduling options for our elementary school, schedule options for our middle school and for our high schools. We also want to make sure that our parents and our teachers too have an opportunity to be able to take advantage of those options. So understanding that once you see these subgroups, once you'll see the volume of work that these subgroups did, you'll understand that there was 2 weeks. These subgroups just didn't meet one time. Some of our subgroups met 3 to 4, if not 5 times over the last 2 weeks. Sharon, did you want to jump in and just kind of, I feel like I'm just telling the narrative, but I think as a board member, you could just kind of shed light to the board on just the volume of work that's been done so far.
Yeah, absolutely. And that's where the details are going to come from. So we had a whole subgroup that just focused on ELL, and they made some really clear-cut recommendations about what's going to work for that population in the 3 models. The same thing with special ed. We have a lot to read through, which is going to be shared, Dr. Mosley, correct? And you will be amazed at some of the creative suggestions that they came up with for all of the models, especially the hybrid model. I was pretty amazed. So you will get to read this. It's not a secret. We're not holding it away from you. And we will hopefully hear questions from you too after you've read it, or you will have a couple of aha moments and say, I would never have thought of that. It's a good thing that this subgroup was made up of people who focus on that particular issue or that particular population. It is pretty amazing what they came up with. And I think that those details are going to be worked out. And with Mr. Norris, I understand what you're saying about the high school schools being difficult to navigate, but that's something that the administrators at the high school are going to be able to handle, and they have been on the committees as well. So, any other questions, Dr.
Well, I think Sharon, what I was getting at was I was excited to see those out of the box things. When do you think you're going to have them ready for us to, chew on?
Dr. Mosley, it's soon, right? Isn't it?
Yep,
Tomorrow, maybe.
Yep, it'll be something, but I just want to be very clear. We don't, because the size of this district, it's not me making this decision. It's not Sharon. We have to go back down. I say go back down, but we also work with the elementary principals and they share with us. We also work with Dr. McKinney and they give us some feedback as well. We've gotten some feedback on the kindergarten classrooms, and some of our kindergarten teachers, honestly, they talked about rather than having 22 kids start, how that's going to feel and space out and have those kids return in some hybrid form. They're not interested in that, but they also, as Bobby Bagley said and made it very clear, they have to have PPE equipment, and that has to take form too. In the event that we are forced to do a kind of complete remote as a result of our spikes in cases, we also have to be prepared to switch and move to model number 3. So we don't have to say that we created this hybrid model right now for our elementary school. Right now, we collected data, as we said in our PowerPoint before, got that feedback from our subgroups. And to be honest with you, Jen, there were more questions that came of it, more questions that we didn't even think about, and more questions that we start to wrestle with as we are, as Bobby said earlier, some of our kids are getting sick, and some of our kids have family members that are sick too. So what we're doing right now is, number one, we have our extracurricular going out, and number two, we're starting to get this data and starting to really look at the data and create a hybrid, but also a remote learning component just in case there's a spike. Go ahead, Tara.
Dr. Mosley, I just wanted to remind everyone that the data that is going to be presented or given to you, shared with you, is just coming from a subcommittee level, the 13 subcommittees, and it's dense, and there's 40 pages sometimes per committee. And that's just the subcommittee's recommendations. It is really the task force's job to take all that information, synthesize it, go through it, and then make a presentation to the board. So your decision shouldn't come directly from all this data. Your decision should come from the task force. And there's going to be a lot of meetings over the next 2 weeks to try to make those recommendations, plus additional meetings with principals, because it is going to be a lot of, as Dr. Mosley said, each school is different and will have to present differently. So we'll have to rely on them heavily to give us those little details as to what works for that particular school. So.
Right. Thank you, Dr. Mosley and Ms. Quintanilla. Ms. Bishop, did you have anything else?
I would like, and maybe I missed this, just some clarification on well, no, that's a big question.
Okay. All right. Put it, what did they say? Put a tack in it, and then we'll get back to it if you can think of a way to phrase it, or hold it for the next work group.
I'll just keep it close to my heart till the next meeting.
I think that's a good plan. Okay. I just want to make sure, Ms. Oden, Ms. Timmons, or Mr. Gao, did you have anything before we start going to follow-up questions?
I do, Heather. It's
Okay.
Mrs. Oden. I know they said this is going to be on the website. When can our stakeholders expect for it to be on the website? The presentation tonight. When can they expect to see it on the website?
We'll try to get it up tomorrow. Matter of us getting it actually in hand, and we'll have it up as soon as we can.
Oh, great. Thank you. Also, will it be on the front page? Will they have to go looking for it, or will it be bold on the front page?
Typically, we have that link that's under the news, and that's where we've been populating all the task force information. What we could do is send out a prompt to let people know that that's where it is, and have a direct link to that.
Oh, thank you. I think people would appreciate it. I want to thank the people that have been working on this. It's obvious from the presentation and what from Sharon has said, and Dr. Mosley, there's been a lot of time and effort put into this. Everybody has this challenge across the country. Nobody has said it's easy. And I think we're trying to do what is best safety-wise for all of our students. There's not one perfect solution for everything, and I give all of you a lot of credit for what you're doing, so thank you.
Thank you, Doc.
Thank you, Ms. Oden. Mr. Gao?
Thank you. I have one comment and then two quick questions. First, regarding the parent choice model, I know one of the big issues was that the mismatch in the ratios of teachers and also students. That totally makes sense. And of course, if we do go with the parent model, there would be some need for some sort of stratification where the numbers are slightly adjusted on both ends to kind of match. And I would want to point out that really either way, whether we give parents a choice or not, at the end of the day, they do have a choice. That even if we go out with a model saying like, okay, this group of students go to school on this day, plenty of parents, I'm sure, will still choose to like keep their students at home and everything. And just considering and weighing the pros and cons of both options, it makes more sense to me personally to go with the parent model, because this way you get to stratify everything, you get to adjust everything based upon the parent's decision. Whereas the other way, you're assigning the parents this role, they're changing their position on it. They're choosing to not have the children go, and then we have to re-stratify, reorganize everything based off that. It just seems like logistically, administratively, a bit more to do. My first question was just in terms of like after tonight's discussion, it really does seem that like we're leaning towards some form of remote learning, either in Model 2 or Model 3, which is full remote. So I want to know just like what sort of preparation do we have, whether it's like PD or whether it's just software, things like that. I know I'm in the remote learning subgroup, and we discussed that like you need these different licenses perhaps for software. We went pretty deep down the rabbit hole of the different things that need to be modified if there is this remote learning component to truly make it a viable, like a high quality solution. So I'm wondering, what are the next steps in terms of that? Is there going to be another like group put together to kind of investigate how we can improve remote learning, or what is the development on that?
I think that's a very good question, Josh. Am I on? Okay. That's a very good question. And my response is number one, the curriculum and the remote learning is germane to the grade level. It's very like Seesaw is a very popular elementary online platform, whereas at the middle school we have our Amplify Math, whereas that's our science. So those online resources as well as in-person resources would be available. And then when we move to the high school's a little different, as you know. It's much more independent work. There's much more kind of a teacher, depending on the grade level, sometimes a mentor-student relationship as well. So that all depends. As some of our kids have had, and I'd say our parents have had some mixed reviews on, and it's no one's fault, but let's just face it, some of our parents are not computer savvy as they'd like to be. But we have to prepare, and I'm not going to make any bones about this, that we need to start preparing for a hybrid model as well as a remote model based on some of the trends that could potentially come our way. We want to be able to move in a model seamlessly, not because we made recommendations of that or not, but we just looked at the data, looked at the and coming from the recommendations from public health, but also the trends that are going on right now. We don't know if we're going to have a surge or not. And we also have to be cognizant of our faculty's safety as well. Just because we have 10, just because we have 15 teachers in one building, that does not mean 15 teachers are available to come in and do hybrid learning. They just won't be able to do that. And so we have to be cognizant of that. And we're going to be doing some collaboration with our union, with our teachers. And we're going to take as much time to keep people safe, but also make sure that they know they're going to be safe. And I'm happy to have those discussions and to take the time and investment in our faculty.
Okay, great. Thank you so much. I just want to make sure I'm understanding correctly what you're saying. Like, are you saying that maybe after we have a bit clearer idea of which model we take, that's when the research into whether we want to start enhancing remote learning will begin?
The way I see this, Josh, as I said earlier, there'll be some professional development and some education for our parents because they've requested that. Also, some opportunities for our teachers to get some additional training and resources for online professional development and some resources too. So it's going across all platforms and demographics, if that's helpful. I wasn't sure does that answer your question?
Yeah, that makes sense. Thank you. And also just my second and final question, I was wondering, so like under Model 2, the hybrid model, the initial model that was suggested was just one way, I suppose, that a hybrid model could be developed. Like I know another parent choice model was suggested. Like I'm sure there are plenty of different permutations, different configurations that a hybrid model can take place. I'm just wondering, for people with maybe new ideas on how to structure the hybrid or Model 2, how should they bring those up, and maybe like how will those be considered by the task force? Because I'm sure there's many other ways to structure it.
The people, and again, I think I would say that the people that know the schedule the best are the building principals, to be honest with you. And they know it in a way where they know the personnel, they know the students. And even if you're, just because you have, quote, 22 kids, you have to make sure that you divide those kids up in an appropriate way. You have kids that have special needs. You have ELL kids. You have kids on 504 plans. You want to make sure that you have a balanced and equitable classroom. We have kids, and so that takes time, and making sure that there is equal distribution of that. when you're making class structure. The other piece is that the CDC has made some recommendations on spacing in the classroom, and setting that up and making sure that that is followed through is also another factor. And I said earlier, I don't want to belabor this anymore. We also have to make sure that the teacher's comfortable and the principal and sometimes our administrators are comfortable being in the hybrid model as well.
I apologize for that.
Sorry. Thank you, Dr. Mosley. I appreciate
Sorry, didn't realize I wasn't on mute, and my daughter's very excited. Thank you, Dr. Mosley, and thank you, Mr. Gao, for that. Ms. Timmons, did you have a question or a comment for Dr. Mosley?
Yes. I'd like to thank Dr. Mosley and Ms. Giulio for all the work that they've done on the task force. It's a lot of work, and there's a lot. I'm listening. I think we learn a lot by just listening and depend on the experts. So I'd like just to thank you, Sharon, and also Dr. Mosley for all the work that you've done. That's all my comment.
Thank you.
All right. Thank you, Ms. Timmons. Mr. Guarino, and then Ms. Brown, and then I have a couple questions just about what the board can do to help facilitate anything that we could help facilitate. So go ahead, Mr. Guarino.
Sure. I just wanted to say something about surveys. We get, we never really get 100% on surveys. You'd be surveying every single person. If you get 20% response on a survey, you're adequate. Dr. Mosley had 50% response on some of them, and then he qualified one of them where he had 1% response, which is not that reliable. So I think Dr. Mosley, the way he presented, the way he structured the surveys was fine. I had no problem with it. And the way he presented the data, I think it was reliable. From what I've seen of surveys, and I use surveys all the time. So if you get 20%, that's a rule of thumb that you're doing pretty good, and your data that you're getting is reliable. And that leads us to data. Data has to have a narrative. You have to, people sometimes can get the wrong idea about data if you just dump a whole bunch of data out there. And I agree with what Dr. Mosley said. You have to have a narrative. You have to tell people what you did, how you did it, how they should use the data, and how you got the data. So I think it's very important. You don't just dump the data out there so people can get the wrong idea, or deliberately or by accident. And I just want to say that about the survey. I have no problem with the survey and the results, the way it was presented. To Mr. Norris, he was talking about concrete plans, and that's exactly what we're doing. We're trying to create a concrete plan. But remember that things are dynamic, things are changing. And I like the fact that there's going to be monitoring, and if there's a spike in COVID, that we can do something about that and respond to the conditions, because the conditions are dynamic. You can make a concrete plan and execute it, but if you're not adapting to what's going on, then it's not, it can be the greatest plan, but it's not going to work. So I like that. I like that we can change if things change. We have to be responsive. So I think what Dr. Mosley said in his presentation is that August 3rd, we're going to have sort of more definitive description of the way forward. And so I'm looking forward to that. That's all I wanted to say. Thanks.
Yep. Thank you, Mr. Guarino. Ms. Brown?
I just had two last little questions. It's about information for tomorrow for the task force. They're communications related. We reached out to other either area districts here, because we will have some of our parents that teach in Amherst or Hollis, or vice versa. Some Hollis or Amherst teachers or parents teach here in Nashua or even in Northern Mass. Have we looked at reach out to any of them or any large urban districts to see what they're doing, to see if there's something that we don't have to completely start from scratch as we're finalizing this concrete documentation, which I think is really important. And then my second question, that's also communications related, just so we have some information going into the next few days here. Have you had an opportunity to reach out to the Nashua Teachers Union president to start working on like an MOU for the hybrid model 1, hybrid model 2, hybrid model 3, and then a backup for remote, could you kind of start pre-chatting so that we can make sure that ducks are in a row for once things get moving? Have you reached out to them?
We have, it's not, the answer to your question is that, a couple things is that I have reached out. I believe we have something scheduled this week. Is that correct, Tara? With the union leadership, we have something scheduled. I think that's important. Part of this I don't know where this MOU is where the genesis of that is. I think that part of what is important before we talk MOU is just have a discussion of what they're looking for and the terms of that. One of the things that was great, and I just want to say thank you to not just the leadership, but just to the teachers, just with everything you did. We didn't even have an MOU for the remote learning, and it was incredible. I mean, just a credible thing that they did, and that really speaks to the commitment of the teachers, but more importantly, the trust. I'm not moving, or we're not moving until we have that discussion with them, and we already have many of our union people part of our subgroups, and so they know that this stuff is going on, and they know that the best intentions. Would it come to an MOU with some teachers that can't do it in our current remote learning environment because they have some, whether it's a physical piece or they're at high risk? Absolutely, we're going to have that, and that's something I covered in the presentation. Before we start throwing out legal documents at each other, we're going to have a dialogue about that, and it's not just a one dialogue; it's actually a multiple dialogue around. How can we do this together? We can't, I can't do this. I can't do it in the vacuum. We can't do it through subgroups. We can't do it through, not just with the teachers union, but also with the directors, also with the custodians, also with the principals. I mean, we've already had these discussions and we have these meetings, but, to Sharon's point is that we really have spent the last 2 weeks meeting multiple times in these subgroups. And then when I'm done here, when this meeting's done, I'm calling Stacy and I'm calling some of the other people. We're going to keep working through the night to get this stuff up, but also to move to the next step so that the meeting tomorrow can not just have the presentation, but we also are fielding phone calls from parents too. So this is not, I think you asked Ms. Brown, have we saw and reached out to districts our size? The answer is absolutely. Sharon, I don't want to speak for Sharon, but I know that we've also looked at other districts in Massachusetts, and we said that earlier, particularly Lowell, Brockton, Springfield. We do look at Manchester, and to Dottie Oden's point, there's no magic bullet here. There's no magic schedule. There's no practicality in all of this. We're moving and having discussions in the best way that's germane to our students, to our situation, to our union contracts, to our pay scale, to our flexibility with our current schedule. So I believe that at some point we're probably going to have some flexibility and understanding with the teachers union and with the administrators on just what this school year feels and looks like moving forward. So the answer to your question is I do have a meeting, but it doesn't mean it's a meeting I'm going to come and have all of the answers. We have a series of meetings and planned meetings that we're going to continue to engage in dialogue.
Okay, thank you, Ms. Brown, and thank you, Dr. Mosley. I had a couple questions. I promise I will be brief. Really one basic question, and that is earlier today or this evening, we were talking about PPE, and I had jumped in there with, can people, donate PPE? But also, I'm starting to wonder about purchasing of PPE. Do you want us to put on the calendar? We have a placeholder meeting Monday for a budget meeting, which I was thinking like if we had to change things based on the model we picked, but that seems to be premature. So I'm wondering if an extra finance meeting might be more appropriate, or any other kind of meetings where you might need board approval for purchase orders to start purchasing some of this protective equipment, so that it isn't, I worry if we wait till August that we might not get it in time for school to start at the end of August. But I guess I kind of talked around it. My question is, do you know how long it takes to get it? And
So
if so, when do we need to make sure that you get the authorizations you need in order to make those orders? There we go.
So you ready? I thought I had it all planned out, Board and Heather, like ready. Okay, we're gonna order just remember, I think I said 5,000 masks at one point, and we started pricing that out. But I think just understand the flexibility. I don't know if when Bobby started talking today, she actually said that she emailed, I think it was Stacy Hines, an email that basically said, how about this PPE looks really good for kids? So if you ask me now, should we get the mask or what Bobby just emailed me today, I would definitely go with what Bobby said to me today rather than going with the traditional PPE equipment that we were talking about 2 weeks ago. Right now, what I'm going to do is that there's a couple of things I'm thinking about, to your point, Heather. PPE equipment for our kids and for our faculty as well, but also to, and this is a question I don't have an answer to, what does a first grade classroom look like? And when I say look like, do we get the shields? And I'm not doing any justice whatsoever to this, but when Garth was meeting with his group, they had large discussion on, okay, how do we create a divider in our classroom? Do we make some modifications to our seating arrangements so that there's just 10 kids in? There was some discussion around cubicles. Do we totally move away from just having kids' desks and create cubicles for kids to sit in? And so, again, I'm going to leave it back to the experts. To the kindergarten teachers are, what does a kindergarten classroom look like in the Nashua Public Schools with social distancing and 12-ish kids in it, and what's the equipment look like? And I think they actually started talking about that in their meetings already, and now we'll have that. So the answer to your question is PPE equipment, but it's also equipment in the classroom. So I'll have more information on that, and certainly maybe having that budget meeting would be good, but it's a fluid situation, and certainly we can get you some numbers on that as well.
Okay, I just want to make sure that we are being, that we as a board are providing the maximum amount of assistance that we can to make sure that when we open for the fall, in whatever permutation that looks like, that our faculty, our staff, and our students have what they need, and that we have some idea of how much it's going to cost and how we can pay for it, which I completely trust Mr. Donovan, 100%. I'm just wondering about the board part of it and scheduling, because we have a lot of meetings coming up over the next 2 months anyways, on how to make sure that we schedule these things timely and effectively to make sure that the district has what it needs. So we can continue to communicate offline about scheduling. So
I wouldn't, if you ask me a number right now, I don't have it in my mind, but I think it's important that as we start to plan for the reopening recommendation, that we put something in the calendar around budget. I had a meeting with Dan, just a kind of a side note, that we were actually thinking about having not just the budget, because I think last week we talked about an update on the budget. Heather, I think you talked about having that.
Yes, and that was my idea, was do we have to shift things from, because when we created the budget and approved the budget, it was early, it was created, last year. And then when the board approved it, it was early in the pandemic. So the district's needs very well could have changed since the board approved that budget. And I would, I'm anticipating that you may want to have some changes to, where monies are allocated that may or may not need board approval. I don't know. So that's pretty much what I was looking for a budgetary update. I think Dan Donovan covered the one-time funds very well in our budget presentation and then again in finance last week. So
Yes, I'll say yes. We can work offline and schedule that. Does that work?
yes, that's fine. I just want to, that was really my question through all this. How do we as a board manage that if we aren't going to be ready to make a decision until the end of the month? So, and as a parent, I know that all the other parents out there and all of our staff too are like, what's going to happen? What kind of plans do I need to make for the fall? Do I need childcare? Do I not need childcare? Do I need to be, working things out with my pod or my bubble of people to make sure that there's somebody home who's an academic support or not? And so we're all very anxious, and I'm sure that came through in the meeting tonight, and I'm sure it's coming through in all the emails. So no pressure, but we are anticipating trying to make all these plans in a short amount of time.
Can I just clarify a couple things?
Sure.
Never mind. Nothing. I just wanted to, Tara, I just asked a question about just meeting with the union. Do I have a meeting scheduled with the union? Because I think Ms. Brown, I'm sorry, Ms. Brown, you're on my right. I just want to make sure that I didn't misspeak.
I talked to the union about scheduling one. We don't have one actually scheduled yet, but I talked to them earlier today about doing that.
Who's the speaker?
Adam.
Okay, thank you. All right, fair enough.
Okay, well, hopefully that goes well. I giant kudos to the teachers union and all the staff for all the work that they did this spring and this over the summer. All of the teachers and staff who have been involved in these subgroups. I'm blown away by the caring that everyone is showing for our students. And in the community too, to have Ms. Bagley come tonight.
Great, I really appreciate that. Thank you, man. I just want to say thank you to the city. I'm sorry to cut you off.
No, yes. More thanks are always good. Okay, Ms. Giglio.
Yeah, I just wanted to reiterate what someone just said a few minutes ago, which is that we have to be a team. We showed in the spring just how well we work together and how we can get things accomplished. And this is going to be more of teamwork. It's really important. And I also, speaking of a team, I appreciate the gratitude expressed, but I also want to include Stacy, Tara, Gabby. They've been doing a tremendous amount of work behind the scenes, and I don't know that I would be so optimistic if it weren't for them and all their hard work. So I feel like we're going down the right path. We have the tools we need, and we're going to figure out how we can use them to the best of the students' safety and staff safety. So I am optimistic. We'll get there. We may not be it won't be perfect, but no district in the country is going to get it perfect.
No.
We'll do the best we can.
I mean, LA, what was it? LA today just said, hey, we're going remote.
Yep.
We're just trying. San Diego's okay.
Also, Nashville and Atlanta.
Yeah.
And just went remote, and we're just trying to be as creative as we can, and just trying to do the best we can. And certainly, and there's no right or wrong. If I made a mistake or Sarah made a mistake, I apologize. We're just trying to support each other and build each other up, help each other, bounce ideas off each other. That survey was written by myself. I gave it to Sharon. Sharon said you missed a couple of words here and there. We're not survey experts. We're just trying to do the best we can. And we're not meeting face to face. We're in Zoom meetings all day, and we're communicating by text, cell phone, and everything. And it's hard. So I just want to say thank you for everyone. We still got 2 long, grueling, hot weeks to go before this all comes to something. So we're rolling up our sleeves and we're just going to do the best we can.
Thank you, and I appreciate it. I think that's the end of the agenda. Did we miss anything?
No, I think we're good. We got a lot of work.
All right, great.
So I'm ready. I got to go with people. Let's go. Stacy, I'm going to give you a call.
All right, thank you, everybody. Before the board can leave, we do need a motion to adjourn.
I'm going to call you, Stace.
Okay. So,
I'd like to make a motion to adjourn.
okay.
I will second.
Thank you, Mr. Guarino. So the motion to adjourn is made by Ms. Giglio, seconded by Mr. Guarino. Mr. Guarino, would you like to call the roll?
Okay, Mr. Guarino votes yes. Ms. Johnson,
Yes.
Ms. Ziem, please. Yep. Ms. Ziem, can you hear us? I'll get, okay, yes, I heard it say yes. Okay. Yep. Ms. Bishop,
Yes.
Ms. Giglio,
Yes.
Ms. Brown,
Yes.
Ms. Raymond,
Yes.
Ms. Oden,
Yes.
and I think Ms. Timmons left for the night. Motion carries 8-0.
All right, thank you all for coming out. Don't forget, we have a meeting Wednesday at 5:30. That's our regular meeting. Ms. Constanella, is it HR at 5 or 5:30?
5 o'clock for HR, 5:30 for our regular board meeting.
Okay, yes, I got it right. So I'll see you all Wednesday evening. Thank you.
Thank you. Have a
Good
good
night,
night.
everyone. Good night.